Welcome back, folks, for part 3 of Managing Your Mental Health with Mr. Nathan Russell, our social worker from Family Health Team. I'm Dr. Enoch Daniel. Nathan, you've given us some wonderful material here to work with. I kind of want to talk a little bit about some of the most vulnerable in our society, not necessarily for the disease component, but from the psychological aspects of all the stuff that's going on in our society, and they're kind of absorbing this kind of secondhand, just kind of hearing the room, and who I'm talking about here is our children, from the little ones to our teenagers, and how can we help them understand this? How can we put it all together for them? Any tips or tricks for this?
Yeah, I would encourage parents to reassure their kids that they are safe, that they are taking all the recommendations and the precautions that are necessary. I encourage you to let your children talk about their worries and fears, and more than anything, share your own coping strategies with your children. Kids learn, no matter what age they are, they learn a significant amount from behavior modeling. So the way that we carry ourselves and react to things and cope with things is very important in terms of teaching our kids how they can as well. When it comes to the day-to-day stuff that parents are going through being at home with their kids right now, one of the best things you can do is try to build structure and routine into your kids' day so that things remain consistent for them. When kids know what to expect every day, they cope a lot better.
Well, Nathan, thank you for that. That was great. A lot of material here. What about resources for patients to kind of go and have a look at? What kind of resources do you recommend again for this?
Yeah, so our website has a wealth of information on it. Everything from the pandemic itself, if you're trying to be more informed, to things like children's activities that we're hopefully going to be updating a couple times a week. We're also hoping to upload a link for something called virusanxiety.com, which is a really neat website that you can go to that helps you create sort of your own personal toolkit for coping with what's going on in the world right now. Other things like we talked about before, apps for your smartphone like Headspace, Mindshift, Calm, those things can all be really, really, really helpful. And additionally, if you do need help, please reach out, talk to other people. It's more important now than ever. Even if you are not a patient of the health team, please reach out. We will try to link you with the appropriate resources and everything that is accessible. So please, more than anything, reach out to other people.
Nathan, thank you so much for that wonderful discourse. Actually, there's so much to digest, and I can't even think about all the things. I remember sleep, I remember mindfulness, compassion, or mindfulness, self-compassion. It's a lot to take in. Would you be able to summarize all the salient features for us?
Yeah, so really, managing your self-care more than anything. It's important now more than it's ever been. And again, that self-care can involve anything from meeting your body needs in sleep and exercise to your emotional needs, which involves sometimes journaling. It involves those self-check-ins that we talked about. Supporting your children, checking our website for all the great resources that we have, and I cannot stress enough, reaching out and connecting with other people.
Nathan, thank you so much for taking your time to discuss this issue with us. These are really, really difficult times, and I'm hoping that everybody will find this extremely helpful. Thank you, everybody, for being with us here today, and please feel free to pass it on to your friends and to whoever you want if you think this is going to be helpful to them. Thank you.
Thank you.